I am Washoe County Commission Chair Bob Lucy. I want to thank all of you for being here with us today, and for those who tuned in online, thank you for watching. I want to start first by thanking Nevada's Governor Steve Sisolak and his team for his dedication and their team's work for their steadfast approach and support to lead this charge. They've been working around the clock with and as well with our Washoe County teams to ensure safety and health and welfare of all of our citizens here in Northern Nevada, and I'm immensely grateful for that. I firmly believe that in the short term, a quick, strong, and direct action in the face of this dynamic public health reality is imperative to combat a potential long-term effects to our health, well-being, and economic vitality here in the region. As such, we are suspending at this time any Washoe County public meetings for the time being, and I want to assure the community we are not doing this out of panic, but rather in the sense of a public health threat that should be taken seriously. In order to slow the spread of COVID-19, strong actions like avoiding public gatherings in the short term should hopefully help us avoid even larger, more critical situations. As I already mentioned about COVID-19, this is an ever-changing, dynamic health situation that we will be monitoring and providing regular updates on throughout the coming weeks. I understand there are some who might not be concerned about contracting this illness due to its apparently limited effects on younger, healthier people. However, this is not just about the concerns over individual contraction. Rather, this is about limiting of spread of the virus within our community. I cannot stress enough that this is imperative to be mindful of your family members, neighbors, and community as you consider your activities during this time. This is the moment where we can pull together as a community and look to one another as Nevadans. Please be mindful of your elderly and vulnerable family members and neighbors. While younger residents here within the community will not likely be as affected in a serious way, we can help those that cannot fight on their own. Wash your hands, use your sanitizer, cover your cough, and don't take any unnecessary risks if you are feeling symptomatic. At most, Washoe County schools will start their 2-week spring break today. I encourage all Northern Nevadans to use that time to be vigilant, assess their preparedness at home and work. I strongly encourage everyone to avoid public gatherings and consider their travel plans carefully and be mindful of their surroundings and situations. We are positioned effectively to manage the spread of the coronavirus within our school systems and have the tools at our disposal to do so. As a father, I can assure you that the children of the region are my first priority and will continue to act accordingly. The coronavirus is very serious, and as such, we have taken a very serious approach. However, this is not a cause or call to panic. Yet be prepared and be smart, be clean and be vigilant. If you have flu symptoms, please call your physician and our health district here in Washoe County. Calling 911 at this time should only be for life-threatening emergencies. I repeat, only for life-threatening emergencies. Despite the fears, common sense must prevail at this time. I would be remiss if I did not mention the greatest asset here in Northern Nevada, which we put our full force and faith in the face of this pandemic. It's our very own Washoe County Health District. They have been monitoring and working directly with the CDC and the federal government since its inception of this virus, and will remain to be the authority here with the evolution in Reno, Sparks, and the county. I also want to thank all of our regional partners who have been a model of collaboration through this process. We are the most effective when we are the most effective in our community when we work together, and I'm proud of all the work that these men and women have worked on during times like these. I know when we come together in this time of interest, we continue to serve those that are the most important in our community. Our hospitals and our first responders are focused on caring for those citizens, but we need your help. There are systems in place to navigate through these right resources to get the proper testing if needed. If you have any questions or concerns, please call Washoe 311. On your phones, just dial 311. Resources are available from the county and the state authorities right now. Please utilize them. At this time, Washoe County is not declaring a state of emergency. The state has done so, and we are currently coordinating our resources with them, and we want to thank Governor Sisolak at this time for leading the charge on that initiative. Believe me, this is the appropriate course of action. And with that, I'd like to turn it over to Washoe County Manager Eric Brown.
Well, good morning. Eric Brown, Washoe County Manager. I'd like to thank Chairman Lucy for his leadership on this issue. And as mentioned by the chair, our goal is to ensure that the health and safety of our employees and our citizens are taken care of. And because the COVID-19 situation is fluid and developing, we will continually update our information on our website and our other social media and media outlets. As Chairman Lucy said, we are suspending all non-essential travel as well as meetings and gatherings in order to follow the CDC's guidance on social distancing. In addition, the health and safety, as I said, of our employees is the biggest concern. These are hardworking individuals, and if we don't take care of them, they won't be able to take care of the rest of the community. We realize that. So we've instituted measures to make sure that we're following the CDC and the Health District guidance with regards to travel, unnecessary meetings. We're also instituting teleworker arrangements across the county so that those that don't need to be in the office or in their facilities-based place of work don't have to be. In addition, we're staying away from the handshakes, encouraging people to do the elbow bumps, et cetera. And we're stepping up our ability to make sure that the workplaces are clean, particularly at those contact points where the public is involved. Please know, we're still here working for all of you and redirecting our efforts to better manage the COVID-19 issues here in Northern Nevada. We too feel that the governor's decision will be a huge benefit for us. And as mentioned by the chair, our health district has been particularly vigilant in this situation. I can tell you, in my prior position at the California Telehealth Network, I got the opportunity to work with a lot of health districts and municipalities on emergency preparedness. When I think about the folks that are represented up here today, whether it's the fire district or the sheriff health district, as well as our counterparts in Sparks and Reno, this region is really, really well situated in terms of our ability to communicate with each other, coordinate our efforts to serve your interests. So with that, I will turn it over to our health district officer, Mr. Kevin Dick.
Thank you, Manager Brown. I'd like to begin with to remind everybody of our status here in Washoe County. We still have just 2 COVID-19 cases in the county. We have one of those that's been confirmed by the CDC, another that's a presumptive positive, and we expect that will be confirmed. We treat that as a positive as we react. We have done the case contact investigations to identify close contacts. Those people have been appropriately isolated for a quarantine for a 14-day period. They are being monitored to see if they develop symptoms of the disease. We exercise that quarantine so they are not out in the public. If they do develop the symptoms of the disease, as far as reducing any potential that they have for transmission in the community. Our cases in Washoe County have come from travel that has occurred to Santa Clara County or from the cruise ship on the initial leg of the Grand Princess cruise down to Mexico before they departed in San Francisco. I would like to join Chair Lucy in applauding the governor's decisive action to declare the emergency for the state of Nevada. That will give us additional tools and flexibility to respond to this situation. Will help us with our priority with federal resources that are available to our state and local agencies, and allow us to operate with fewer restrictions in response to this. Yesterday, the Health District issued a press release regarding public gatherings in which we strongly support and recommend that public gatherings be postponed or canceled. We have seen a good reaction and great consideration that we have of, from different events and event planners with cancellations occurring, including the Leprechaun run that was scheduled for tomorrow morning, the Leprechaun crawl scheduled along the river. The city of Reno has taken action to cancel their public gathering type events associated with Park and Rec through April. The city of Sparks has also taken action to cancel events, and we also understand that the school district in Northern Nevada area superintendents have agreed that they will be suspending athletics and extracurricular activities. So this is all in an effort to promote social distancing so that we have people that are not gathering together in conditions that would facilitate the spread of disease. This is really important for our community now. While we are at a low risk currently because of just the two travel-related cases that have been confirmed right now, we are seeing in neighboring states and are now seeing in Clark County cases that are occurring from transmission that has happened locally there. And so it's important for us to be taking action now to stay in front of the situation, to work diligently to prevent local transmission occurring here, to reduce any potential spread through all of those practices we've been talking about, the hand washing, the sanitizer, staying home when you're sick, coughing in your sleeve. You've heard all of these. We need to continue to be vigilant with that, but we need to start increasing our attention to what are the interventions and mitigations we can do in our community to reduce the close connection and gatherings of people that would help to spread that disease. We're in a good time of the year for this right now because the school district is going to be closing for a couple of weeks for their spring break, and we have the UNR closure for spring break coming up as well. The Washoe County is currently at a level 1+ designation for our Regional Emergency Operations Center. Last night, Governor Sisolak activated the State Emergency Operations Center to be up and running, and so we'll be discussing with our county emergency manager and our county manager going to increase levels of activation on this as we move forward. We're working also with the governor's office on the return of our passengers, our residents that have been passengers on the Grand Princess cruise line. We heard the governor's frustration last night in that we are reliant on federal authorities for when they arrive back here. The latest word that we have heard is that is expected to occur later today, and we are prepared to meet those passengers and have them transported safely back to their residence for the quarantine period. These passengers are all asymptomatic, and so we will be monitoring them over that 14-day period to take appropriate action if they do develop any symptoms. We're also working to provide appropriate information to our public safety partners. And I think we've seen in some attention to this in the media. The residents that are coming back from that cruise line and other citizens that are in isolation and quarantine retain privacy rights that are afforded to them as U.S. citizens and as state citizens. And so we're working with the governor's office and the state attorney general's office to receive a determination of the appropriate information to be able to provide to our partners. And we're also working on other mechanisms to be able to have them provided with information they need regarding these folks. But I want to also, again, remind everybody that this could be any one of us that unfortunately comes down with COVID-19. And so we need to respect privacy. We shouldn't be fearful and stigmatize these people. We should appreciate what they're doing by isolating themselves to protect the rest of us from the spread of disease. As far as testing goes, we have adequate testing capacity with the Nevada State Lab. The national news is talking about shortage of test kits that are available, and the state lab has a good supply, and they have also plans for regular resupply. So we're not in the situation that some communities may be in with a shortage of testing capability. But that said, we're not in a position where everybody in the community is going to be able to be tested for COVID-19. We are still working with our hospital healthcare providers and through our epidemiologists on an approach where we're identifying people that are at highest risk for exposure to COVID-19 or who have developed more severe symptoms to have priority for that testing. And so we encourage the people in the community, if they do have symptoms and are concerned about the potential they may have had for transmission for COVID-19, to contact our number 328-2427 to be able to have our people talk with them and conduct that risk assessment. And if necessary, we'll have them scheduled for sample collection for that testing. I believe moving forward, we're going to have a limited capacity as far as being able to address everybody in the community being tested until we get development of additional types of test kits that could be deployed through our healthcare providers throughout the community. I think everybody's familiar with going to your provider and being able to have a rapid flu test done. We don't have that for COVID-19 yet, but we do have people that are working diligently to develop that type of testing. Getting tested if you don't have symptoms provides no benefit whatsoever. It doesn't protect you from developing COVID-19, so people shouldn't be rushing just to get tested. We need to reserve this for people that have symptoms that we feel are at higher risk of contracting the disease. I also wanted to share and reinforce the message you heard from Chair Lucy of not calling 911 unless you have a life-threatening situation. We need to preserve our emergency responder capacity, and we also need to preserve our capacity of our healthcare providers in our emergency departments. So emergency departments are for emergency medical treatment, and please so don't be using those inappropriately. Contact your healthcare provider if you have symptoms to make arrangements with them before you show up at their office, or contact us again at our number 328-2427. So with that, I would like to turn it back over to Chair Lucy. Thank you.
Once again, everybody, we want to thank you for being here. And also, I want to take a moment to thank Mayor Sheevy in the city of Reno and Mayor Smith in the city of Sparks for their continued and very swift movement in helping us control this. Like I said, it is with great collaboration that we could minimize this massive potential outbreak within our community, and we want to slow that so that anything we can do to maintain the economic vitality of our region and health and safety of all of our citizens. So with that, what I want to do right now is open it up to questions. One of our media directors will help pass the mic around for everybody.
First question is, you said you're going to suspend Washoe County public meetings. Does that mean it's not open to the public and you will still be here and these will be closed meetings where decisions will be made, or the meetings are just completely canceled?
No, not at this point. We are suspending any non-essential meetings, i.e. next week we will be handling our ceremonial meetings, so anything that is not necessary to be handled at this time. There will still be open meetings if we do conduct meetings, but they will not be closed meetings at all. So if there are meetings, they will be open to the public as they always have been. What we've asked is that those meetings on our agendas, we will try to keep as many business items as brief as possible. Follow up?
I'll just ask the question. The 911 calls, are y'all getting an increase in calls because of this? The nature of the calls, what are they saying? What are the people saying if you're seeing an increase in 911 calls to dispatch, and are they related to COVID-19?
From our understanding, we are seeing an increase in calls. However, we want to make sure that those calls, if they are in regards to any flu-like symptoms, are still being redirected directly to the health department through the health department line so that they can be properly identified. And as Health District Manager Mr. Dick had pointed out, we want to make sure that we preserve any potential health emergency room needs directly for those very emergent needs.
This question is for Kevin. We keep hearing the term flattening the curve. Can you explain what that means and talk about why it's so important?
That's a great question. Thank you. So as far as flattening the curve, what that is slowing the rate of transmission and the spread of disease in our community. And so what we have seen, what we saw with the rapid spread of disease that occurred in China before they put their measures in place was that you would have one person getting the disease, and then they transmitted that to several more people. Each of those people transmitted to several more people, and you have this exponential growth of the number of cases that you have in the community. So what we're working to do with our mitigation approaches of not having social gatherings and precautions that we're taking here, recommending that people be careful in considering their travel plans. These are all strategies to try to reduce the number of cases that could come into our community from people traveling somewhere else, and to reduce the potential for cases that do occur in our community to spread to other people in the community. And so to the extent that for each person that does get COVID-19, we could keep the number of people to one or less people that they transmit that disease to, then we won't see, the outbreak and growth of people that have COVID-19 in the community.
And why is that so important for resources with medical equipment, doctors, and things like that?
Yeah, so it's critically important because it will help to preserve the capacity of our healthcare community to provide healthcare services that many of us in the community already need, not related to COVID-19. They have their hands full already with providing healthcare services needed in our community. And if we can avoid a huge spike and surge in cases occurring, that will reduce the flow of people to the emergency department needing to be hospitalized if they have a severe case, and will help to make sure that we all have the healthcare resources that we need.
In other parts of the world, we're seeing a surge in hospitalization related to this, and there's concern over the American hospital system being prepared for something like that. Locally here, do we have enough beds? Do we have enough protective equipment? are we prepared?
We have plans that we have developed with our hospitals over years of work, and so we are prepared. We do have capacity, but as we just discussed, it's very important that our community join together with us in these social distancing and precautionary practices so that we avoid a huge increase in cases that would reduce the capacity of our healthcare system to respond. There are limits to how much that we can do. So that's why it's so important that we start working on this mitigation now and not wait until we see additional rise in cases that are occurring. And as far as PPE resources, we have been working through our Emergency Ops Center, the State Department of Emergency Management, and the Governor's Office with the feds for putting in our supply requests for critical needs. We have had some distribution. The state maintains a stockpile as well of PPE. We've had some distribution that's occurred from that to our local partners, and we expect to see more coming through that pipeline through the federal resource requests.
Do we have a tally on the number of beds here in the county that are capable of taking patients that need to be isolated like this? We do. We have that information, and the state also tracks bed availability at the hospitals, but I don't have those types of figures to be able to provide for you.
What's the health status of the 2 positive cases? Recovering, stable, worsening, and are you still expecting a spike given the way this disease has typically progressed in communities?
I'm not going to get into additional medical information on the cases that we have, other than they still are at their homes, isolated at their homes, so they are not requiring hospitalization for their recovery at this point.
Okay, and again, in terms of the progression of these outbreaks, as we've seen in other parts of the world and the country, what's your expectation now for? You've only had 2 cases now for almost a week.
Mm-hmm. So as I've said to others, if I knew exactly what was going to happen, if I had that crystal ball, I'd be a professional gambler, and but I don't. So but I would not be at all surprised. I would expect that we will have more cases that will occur in Washoe County. I don't expect for this just to go away overnight. This is going to be a sustained response activity where we need everybody pulling together for a significant period of time to really make that impact that we need to prevent the spread and to knock this thing down.
And then regarding the cruise ship passengers, do you know what the holdup is in the federal level? What are they waiting for? I mean, from what we've heard from passengers, they have getting their temperatures taken, but no testing and no progress in terms of getting off that airbase.
I don't want to comment on that because I'm a layer removed from any direct communication with what's going on, so anything you heard from me would just be speculation.
Hi there. What is planned for people in the gray area in that they don't have direct contact or have traveled themselves, but they interact with a lot of people who may have now that it's gotten to our community, and most certainly people that interact with those that are elderly on a daily basis?
So I would encourage them to contact our 327-2427 line, where we have people that will interview them to gather information, because everybody has a unique situation. So we'll collect that information, and we have epidemiologists connected with those staff to be able to provide guidance and direction. I'm glad that you mentioned the older population. CDC has put out guidance, and we recognize that the population of 60 and older are at risk of developing much more severe symptoms and have had poorer health outcomes if they contract the disease. So those members of the community in particular, we want to be taking very strong precautions for reducing any social environments that they're in, the social distancing, recommendations of visiting the store while it's those non-busy hours, so they don't run into as many people there, buying several weeks of groceries potentially so they can reduce the number of times that they have to go out to visit the grocery store, and just minimizing those contacts, outside social contacts. I think that the one thing that maybe people should be thinking about is if they can be outside and they're older and they want to get some exercise and that sort of stuff, if they're out for a walk and they're not in close contact with other people, that should be a safe thing for them to be doing. So people can get cabin fever if they're isolating, but I think we do have opportunities for people to get out and be able to be away from their home as long as they're not interacting with other people in that.
As far as tracking the amount of COVID-19 cases that you guys have tested at the Washoe County Health District, are you guys tracking those? And if so, what is the number of people that have currently been tested that have hit that risk assessment threshold?
Yeah. So we aren't actually doing the testing here at the health district. It's the Nevada State Health Lab that runs the tests for all of northern Nevada. Southern Nevada has a lab with their health district down there. The rest of the state relies on the state health lab that's located with the med school at UNR. And we've been discussing this with the governor's office and the state and the health authorities the last few days for the state to more robustly report on their website on the number of people that are testing, both individuals that test positive as well as individuals that test negative through the state lab and the Southern Nevada Health Lab. And so look for that information to be posted on the state's website.
So at what point would any criteria change? Is that under your jurisdiction, or would the CDC be the person to, widen the criteria?
The CDC has put out some general guidelines, but they have emphasized that state and local health authorities are the ones that will be making the determinations in their geographic areas for what those guidelines will be. So we will consider the guidelines that come out from CDC, but we may be deviating from those based on our understanding and our situation here locally. So that's how we'll use those.
Do we have a number as to how many testing kits we have left?
We have a sufficient supply to keep us going for several weeks, and we have a resupply system that's been established by the lab. So I would say that our lab has been forward-thinking in how they've approached this, and we're in a good situation here for testing capacity. I don't have that number. I don't know if the lab is providing that.
Can people who have symptoms of COVID-19 but no known travel history to an affected area and no known exposure to someone with COVID-19 be tested today?
I'm sorry, could you
Sorry. Can people who have symptoms of COVID-19 but no known travel history to an affected area and no known exposure to someone with COVID-19 be tested today?
Yes, those people can be tested, but it will depend on how they are ranked in our risk criteria as far as priority. So if they have mild symptoms and no travel history and they haven't ruled out flu and viral respiratory diseases and those sorts of things, they may not be a candidate for a COVID sample collection and testing. If they have severe symptoms and are in a hospital setting, that would probably change that equation significantly, and they'd be a higher priority for testing.
So they just have to call that number and talk it through with the person there, but Correct. They could receive testing if they're...
And they would be advised a course of action of if it's not to be tested for COVID-19, to contact your healthcare provider, talk with them about your symptoms, make plans for getting tested and treated for flu or respiratory symptoms. We need to remember that it's flu season, And we do have a lot of influenza-like illness that's going around the community. And so that's why it's important that we do assess for risk and that people also get the appropriate treatment if it's more likely that they have a flu or other respiratory virus.
And then Quest and LabCorp say they've started commercial testing countrywide. Can patients go to their doctor, have a sample collected and sent to Quest and LabCorp for testing?
Theoretically, they can, but we don't yet know what their capacity is to serve our region. So I can tell you that I mentioned the other day, the state has created a requirement for any lab that's testing and finding positive results for COVID-19. They're required to report those results to the health district, just as they are for other types of communicable diseases. I know that we had some testing of that system on the reporting that was done with commercial labs with the health district. I'm not aware of any results that have been transmitted, but the state has been looking into trying to determine what their capacity is to support our state.
If spring break wasn't around the corner, would you guys have shut down schools?
At this time, we are not providing direction to shutting down the schools. We will be, and I have been, in close daily communication with our superintendent, Dr. McNeil, with the Washoe County schools. We will be talking with them about what is the appropriate course of action moving forward. I'm thankful that we have the break coming up right now. That will give us a little bit more time of talking this through and figuring out what the best course of action will be.
If there is an issue of closing down schools, when would everybody start to know?
I'm sorry, I didn't hear
If there was an issue of closing down schools, it became more spread of the disease or the COVID-19, when would everybody be able to understand or know what perimeters to take?
We would be communicating that in conjunction with the school district. And I think you've seen that there are a number of states that have closed down their public schools. We're not at that point now.
Will the daycares be closed down?
No, we have no plans for that right now. That doesn't mean that won't change in the future.
Nevada, at the best of times, ranks near the bottom in the country for access to health care. Does that put the community at greater risk of a significant outbreak? And also, what can the health district do to help mitigate that?
So the question was that Nevada ranks near the bottom for our access to health care for our residents, and will this make an outbreak worse for COVID-19? I don't think that those two are directly related. I think that if we practice our precautions and our social distancing measures, that those are the keys to reducing the transmission and preventing outbreak here in the community. I would say, though, that based on the number of healthcare providers and access to healthcare that we have, which is low versus other states in the nation, if we do have an outbreak, that will put more strain on our healthcare system here because of that. And that's why it's very important that we work hard, we become germaphobes, and we work to mitigate and prevent the spread of this disease and all other influenza-like illnesses in our community.
What is the turnaround period at this time for tests going into the state lab and the results that you get? What is it? It used to be 6 hours when this first started. Is that increased?
So the testing will the turnaround time will depend on how many tests are hitting the state lab that day, and their sequencing of running those tests and the results. Running a batch of samples in the state lab, they achieve a 3 to 4 hour turnaround time on that batch. But if we have multiple batches that are, we've submitted samples and they have to run it in multiple batches, then that's going to extend the amount of time.
One more question. What is the threat? Do you have this in your head? What is the threshold where all this gets to stop? What is the threshold?
The threshold for everything stopping?
Meaning, oh, we can go out now. We can go to a public meeting. I can go to school. I can go to the movies. What are you looking for to where you say, we got a handle on this, we're done?
I don't think we're anywhere near that point, and we will be determining that as we move forward in our response to this.
When it comes to some of these closures like March Madness, spring training, NHL, those things, do you think it's kind of twice as effective because people are avoiding the big crowds, but they're also not traveling to those events?
I think that there is a double benefit to that we're not having that social or the close social contact and the travel that goes with those events. I think it's as sports fans, I think it's unfortunate that we're in this situation, that's happening, but I think it's the appropriate course of action.
Recent news on Representative Porter getting the CDC chief to agree to pay for free CV testing and processes. Has that trickled to the local health departments yet, or is that free outside the health department? Because we're getting feedback from viewers that if they're denied to go to the health district, then they're told to go to the doctor, who then says to go to urgent care, who is costing $300 to $500, according to them, if they don't have insurance. So is that trickling past the health department at this point?
So we're the public health entity for our community, but we are not a healthcare provider. So I can't answer where the healthcare system is. That was an announcement that was just made yesterday that the CDC was going to use their existing authorities so that people wouldn't be charged for costs of getting the COVID-19 testing. So I would anticipate that that's something that's going to be rolling out very, very quick through our healthcare system, but I don't know where they're at with that today. I can tell you that the state lab is not charging us for testing, and we do not charge for the sample collection that we're doing through the health district.
So if I'm a 20-year-old and I think I have symptoms but I don't call the health line, what is the best way to self-manage those symptoms?
Well, I would just stay home and get plenty of rest and drink plenty of fluids and basically take the same approach that you would if you had an influenza-like illness, because you don't know if it's COVID-19 or influenza, and to monitor your symptoms if they're a cause of concern to you for additional health care treatment, to contact your health care provider to discuss that with them. Or if you don't have that availability, to give our line a call to discuss that with us.
A lot of the local casinos in town attract people from all around the country. 2 questions. At what point do you say that the casinos need to be closed for business? And does the health district have the authority to make that call?
So the question was, with the travelers that come from other areas to the casinos and the potential for transmission, at what point do we close the casinos? I don't have a bright line that we've drawn. At that point, we'll continue to evaluate the situation as we move forward. The District Board of Health has broad authorities for public health in Washoe County that could include closing the casinos, but we are not near any point of making that decision right now. Thanks.
Any other questions?
All right. Well, thank you, everybody, for coming today. We really do appreciate. Oh, sorry. One last question.
Just, have you heard, other than anecdotally, have you heard anything in the community about the drop-off in economic activity or visitorship or travel, anything that you're hearing from businesses?
We have been in close contact with the Reno Sparks Convention and Visitors Authority and a number of agencies. It's still very early on to even have that kind of number or even discuss that at this time. What we're still working on is just plans with all of our resorts and communities throughout the region, also in close connection with the state. As Governor Sisolak pointed out last night, he's putting together a task force in regards to a number of those issues, but we are just working and monitoring that as we go along. Once again, we just want to urge everybody to maintain a level of caution in regards to how we can continue to slow this spread. But like I'd like to say to everybody, this is just about being a risk reduction. We really are trying to address this and manage the if any outbreak within our community. But we want to continue to make sure that everybody has the ability to work and continue to thrive within our community. That's not just for our residents, but any visitors to the region. So we want to thank everybody for coming today. We really appreciate it. Please follow along with washoecounty.us for any further updates or at the Washoe County Health District. Thank you.